guess I'll get launched into it. My talk tonight is about optimizing health for fertility. I need to acknowledge that this is a very big topic to tackle tonight. Okay. Please bear with me and see if I can. Okay, so now the main message tonight are the 5 key messages of my talk. If you can't remember everything that I say tonight, these are the 5 points I'd like to take away with you at the end of my talk about preconception health. So the first one is that we should try to be the healthiest version of ourselves when we're trying for pregnancy. And this will maximize the chances of an easier pregnancy and a healthy baby. When we think about health, it's not just about physical health, it's about emotional health as well as social health. Now, when we think about the healthiest version of ourselves, we need to, we can think about weight, we can think about toxins such as coffee, smoking, alcohol, and other drugs. We can think about diet, stress, and sleep. It's also good to see your GP or fertility specialist before you try to fall pregnant for a fertility health check. Generally speaking, what is good for general health is good for fertility health. And most of us should know what's good for our general health. Now, the next point is very important to remember. It's not just about the woman's health, it's also about the man's health, because it takes 2 to make a baby. Now, the next point I'd like to make is that when it comes to falling pregnant and when it comes to talking about chances of success in fertility treatments such as IVF, the most influential factor is the quality of our eggs and the quality of our sperm. And that is largely unchangeable. So it's an intrinsic characteristic and it's mostly determined by our age. But we can still optimize our health by looking at lifestyle factors, which may optimize the eggs and sperm that we have right now. And that maximizes our fertility and success rate in IVF treatments. There's so much information out there that it can become overwhelming and sometimes confusing. So it's best to discuss your individual situations with your medical fertility specialist. The first health optimization focus I like to talk about is weight. So look, weight is just one parameter of health, but it's not the only measure of health that we have. From a general standpoint, both overweight and underweight can affect chances of falling pregnant, and it can increase complications in pregnancy. Now, women who are underweight can be at risk of premature delivery, and women who are overweight have increased risk in pregnancies such as high blood pressure and preeclampsias. They can have higher rates of miscarriages and fetal abnormalities. Women with obesity can have higher complications in labor and more likely to have cesarean section. Weight is not always easy to manage. It's often not just about gaining or losing weight. It's often more complex than that. A lot of us have very complex relationships with food, and sometimes food intake is not just about hunger. So remember that if you are trying to optimize your weight, trying to lose weight or gain weight, you are not alone. You don't have to do that alone. I recommend seeing your GP or nutritionist or dietitian. Just utilize support systems around you. The next focus I want to talk about is smoking. And we all know it's bad. First-hand and second-hand smoke can all decrease fertility and make it harder to conceive. And smoking can harm unborn babies. There's a study that observed that when either the mother or the father is, if they're smoking at the time of conception, the baby can have a higher chance of cancer in childhood. So trying for pregnancy is a fantastic motivation to stop smoking, both for the mom and the dad. And if either the mom or the dad smokes, they should stop smoking before they start trying for pregnancy. Now, next thing I'd like to talk about is alcohol. So we should limit alcohol while trying for pregnancy and during pregnancy. Overconsumption of alcohol can have negative effects on development of baby. It can also affect sperm count in men. So the new NHMRC guidelines for safe alcohol intake is 10 standard drinks a week and not to exceed more than 4 standard drinks in one sitting. But that is not the guidelines for when you're trying for pregnancy. It's actually better than that. So unfortunately, there is no established safe level of alcohol consumption in pregnancy or when you're trying for pregnancy. So what that means is there's no level that we know above which is bad and below which is okay. And this is why the recommendation is for no alcohol consumption in pregnancy and when you're trying for pregnancy. But I think personally, risk minimization and moderation is the key, not necessarily abstinence. Caffeine. Now, I get asked about caffeine a lot by my patients. Coffee has become such an integral part of many of our lives. It's a topic of great concern to many of my patients. There is so much inconclusive, conflicting information that we have to be careful about drawing definitive conclusions. If we look at the more reliable data, we can see that coffee drinking can be associated with, there can be negative effects in pregnancy. And it seems to be a dose relationship. So what that means is that the more coffee you drink, the more negative effects caffeine can have. If caffeine can affect women's hormones, it can affect men's sperm health as well. A study found that women who drink less than 1 cup a day seem to are twice more likely to fall pregnant than women who drink more than 1 cup a day. And the more coffee that she drinks, the longer it may take to fall pregnant. So while this study can raise some concerns about coffee drinking while you're trying to fall pregnant, I mean, if you look at the other way, it does show that women who drink coffee moderately can still fall pregnant in a normal span of time. Another study found that men who drink more than 2 cups of coffee a day are found to have a higher miscarriage rate in their partners. So to summarize, the take-home message is that while you're trying for pregnancy, if you can stop drinking coffee, that obviously is the best. If you can't stop drinking coffee, then try and limit the coffee to no more than 1 cup a day for women and 2 cups a day for men. Next thing I'll talk about very quickly is recreational and illegal drugs. Obviously, you should stop them before trying for pregnancy because there can be negative effects on pregnancy. Drugs such as marijuana or steroids or testosterone supplements can also affect men's sperm quality and quantity. Now, diet. This is a very big topic. And I'm by no means an expert in this area. And we all know that what we put into our bodies can influence everything that we are and everything that we be. General principles behind eating for fertility is a well-balanced diet, high in fresh fruit and vegetables. Whole grain is better than refined carbohydrates, lower in processed sugars, lower in animal-derived fat, except fish, higher in good proteins and fats like plant fats and fish fats, and there are many theories about what is the best diet for fertility. I think that the individual needs to be taken into account. I don't think that one diet suits all. But a general consensus tend to lean towards Mediterranean diet. So high in fresh vegetables, lower in animal fats, higher in good plant fats and fish fats. Stress. Now, this is another big topic. So I have many patients who are concerned that the very high stress levels in their lives are what's stopping them from falling pregnant. So can when they are stressed? Yes. If I think of women in war-torn countries when they're under unbelievable amount of stress, they are still having babies. So Can stress stop us, or can stress affect fertility? Well, the answer is probably yes. We should not discount stress. We know that there can be observable and measurable changes in the body when we are under stress. So it would be silly to discount stress. But have any of you been told to just relax, don't stress? How do you feel then? I know when someone tells me not to stress, stressing will be the first thing I do. So we need to remember that sometimes the stress of not stressing about stress can actually be worse than the stress to begin with. I don't think that it's realistic or productive to get rid of stress in our lives. I think that we should look at moderating stress in our lives. In honesty, I'm still learning that, how to do that in my own life. But I do think that if I'm kind to myself and kind to others, it is a good place to start. And if we need extra support, there is help out there. You can see your GP, you can see a counselor, and don't forget, other supports like your partner, your family and friends. Now, I'd also like to take a minute to talk about sleep. It is so important and it's often a neglected part of our health. Now, not enough good quality sleep can affect all aspects of our lives, including fertility, but also things like immune health, mental health, and amongst other health implications. Many hormones, not just reproductive hormones, but many hormones, they are released in a pulsatile manner. So according to a certain circadian rhythm in our lives. And different people's rhythm are different, but most of us are consistent. And typically, there seems to be this very important window between sort of 11 p.m. and 3 a.m. in the morning when we should typically be asleep. And if we do have disturbed sleep in that important window, or if we're awake during that window when we should be asleep, our inherent circadian rhythm can be disrupted, and that can lead to multi-system dysfunction and can sometimes disrupt hormone secretion as well. So generally speaking, we should try to aim for 7 to 9 hours of good quality sleep. Now, before we start trying for pregnancy, we should also see our GP or fertility specialist for a pre-pregnancy health check. Points of focus include folic acid supplements, so that's a vitamin B group. It doesn't help you fall pregnant, but it does decrease the chances of baby having an abnormality called neurotube defect. It's very worthwhile to be on. We should be on it at least 3 months before we try and fall pregnant. We need to make sure that we're up to date with our CST. That stands for cervical screening test. It's previously known as pap smears. Should have our sexually transmitted infectious diseases check up to date. And we should have a general health check for things like breast examinations, looking at other gynecological medical issues. So existing medical conditions that may affect pregnancy include things like high blood pressure, asthma, diabetes, epilepsy, anemia, heart problems, liver problems, and things like that. We should also be assessed for other conditions like back pain. The back pain can influence pregnancy or even birthing of the baby. And look at other gynecological conditions, so things like polycystic ovarian syndrome, very common, endometriosis or fibroids, pelvic inflammatory disease or other STIs. That can all raise concerns or issues during pregnancy. We should also have a medication review and mental health review, all very important before we conceive. So when it comes to chances of falling pregnant and chances of success in fertility treatment, the most influential factor is the quality of eggs and quality of sperm, and both are equally important. And we can see that when we look at causes of infertility. If we look at infertility patients that I see, we find that 30% will have a female factor in fertility, and about 30% will have a male factor in fertility. About 30% will have a combination of female and male factor. And then the remainder 10%, we won't find any identifiable causes, and we call them unexplained infertility. Now, there is a lot of information out there on lifestyle factors that optimizes egg and sperm health. And at different levels of evidence, there are conflicting contents, there's inconclusive results from studies, and it can be very overwhelming. So to put it into context tonight, when we look at the quality of eggs and the quality of sperm, they're largely unchangeable. So these are inherent characteristics of our eggs and sperm, and mostly determined by our age. But we can still optimize our lifestyles, and therefore optimizing the eggs and sperm that we have at this moment. And so maximizing our chances of fertility and success in treatments like IVF. So if I think of this another way, lifestyle factors is not the be all and end all, because the most influential factor is the quality of egg and sperm, not lifestyle. Other factors that affect fertility success in IVF treatments may depend on the actual underlying reason for their fertility. But again, lifestyle factors are not usually the most influential factor to fertility or IVF success. But it does make sense that we optimize our health before pregnancy so we can maximize our chances of pregnancy, of having a healthy baby. So healthy lifestyle factors can be thought of as protecting our eggs and sperm from ongoing stresses in the environment. And we think the major pathway of these environmental stresses is called oxidative stress, which is caused by free radicals in our environment that can cause damage to cells, including our eggs and sperm. So most lifestyle modifications that we know about increasing fertility and increasing IVF success centers around decreasing oxidative stress. Some women can take additional supplements to try increase their IVF chances. And most of these are antioxidants. So things like CoQ10, melatonin, vitamin E, just to name a few. But back to my key point though, lifestyle factors are not usually the most influential factor in fertility and IVF success. But optimizing our general health and therefore optimizing our fertility health can only help. So back to my 5 key points to take away from tonight's talk. We should be the healthiest version of ourselves when trying for pregnancy. Now, this will help us get pregnant, help us to have a healthy pregnancy, help us to have a healthy baby. When we think about health, it's not just about physical health, but it's also about emotional health and social health. Generally speaking, what is good for general health is good for fertility health. So most of us know what's good for our general health. We should also remember that it is not just about the health of the woman. It takes 2 to have a baby. So it's about optimizing health of the woman and the man. And fertility is dependent on the quality of eggs and the quality of sperm. So these are largely unchangeable. As I said, it's sort of inherent characteristics of the eggs and sperm that we have, and mostly determined by age. But we can still optimize our lifestyles. We can still optimize the egg and the sperm that we have at this moment, and therefore maximizing our chances to either falling pregnant or having success in IVF treatments. Now, there is a lot of information out there, and it is best to discuss your individual situation with your medical specialist or fertility specialist. So that comes the end of my information. I hope that helps you make good choices with your lifestyle modification before you start trying for pregnancy.
Thank you so much, Dr. Alice. That was wonderful. And I know there's obviously so much to go through, but it's really wonderful just to kind of look at the key areas and those really clear key messages. I know I was taking lots of notes, and I'm sure our community was as well. There's been a question in the chat whether or not there will be a recording. Absolutely. We record all our events, and we will be sending a recording replay out tomorrow on email. So keep an eye out for that. And you can also send that on to anyone that you want to share that with. So we do have some questions that our community have sent through from the Drop-In Women's Health community earlier in the week. But I'd love to invite everyone or anyone who's interested tonight in putting forward a question for Alice. Please use the Q&A box below at the bottom of the screen. Pop a question in there. We've got probably about half an hour to go through questions. So if there's anything that you would like to ask, please feel free to ask. Again, you can submit anonymously or not. I know that one's just come through in the chat box, which I will read out now, and we'll kind of get into it if that works for you, Alice.
Sure.
So the first one that's come through from Mary is how to boost pregnancy based on being 40 plus. So she said for the age of 41.
Absolutely, very, very difficult. Is basically back to the biggest influencing factor would be age. So we know that unfortunately our fertility does decrease with age. And so what we need to do is to make sure that the eggs that we have at this very moment is the best possible eggs, and of course the best possible sperm that they can be. So trying to look after yourself, be the healthiest version of yourself before you start trying, and while you're trying would actually be the most influential way to maximize your chances. And so basically be healthy, we eat well, we live well, we try and moderate stress, we get plenty of sleep. And also, I would certainly suggest getting prompt fertility testing as well. It's good to be able to talk to a fertility specialist, because sometimes there are other factors that are not age related that can be treatable. Things like pathology in the uterus, or things like if we're trying to bypass a sperm factor, there are treatments that we can do to either reverse or bypass obstacles apart from age that's stopping us from being pregnant.
That's a really great point you make, that there's so many factors that could be at play that it's important not to make any assumptions around what they are, such as age, and to work with a specialist to kind of look at the whole picture.
Absolutely.
So we've got a few coming through now. Someone again around looking at getting pregnant at 40 is asking, is it too risky to try to get pregnant at 40?
No, I think that absolutely, if you're ready to have a baby, absolutely start trying. I think, be the healthiest version before you start trying. Once you start, I think that if you're having difficulty, do not delay seeing your GP or a fertility specialist, so that you can have tests, both you and your partner can have tests to see if there are other factors that's reversible or treatable. And then, get information, know what your options are for fertility treatment, so that if you do want fertility treatment, you don't miss that golden window of helping you fall pregnant.
And I should mention that we're having another event with Virtus, looking at IVF as a whole topic in and of itself. So we might have a few IVF questions come up, but please, don't despair. We'll be really diving into that in an upcoming event as well, because it comes up a lot, obviously. Another question that we had from Susie is, how important is homocysteine levels when falling pregnant? I may not have pronounced that word correctly.
Yeah, homocysteine. That's a very, homocysteine. That's a very interesting, very specific question, but that's a very interesting question. I guess it depends on which specialist you talk to. So different specialists believe in different things. Homocysteines can be quite important in folic acid metabolism. So in some women who can have sort of derangement in the folic acid metabolism, can actually homocysteine can be raised as an indicator to tell us that clinically there may be an issue. Often it can be bypassed by going on higher dose folic acid replacement. So if you do worry about a high homocysteine level, I think it's very important that you get investigated and talk to a medical specialist to make sure there's no active treatment.
Okay, thank you. We've got a few questions that have come up around supplements. So I'll start with the first one from an anonymous attendee. Could you please explain the benefits of taking DHEA for low AMH, and also explain those terms? Thanks.
Yes, of course. Absolutely. And absolutely very happy to. It's better off that you speak to your specific individual situation to a fertility specialist. I can sort of only talk about from a general perspective. So for those that want to understand what this question means, DHEA is basically a a sort of male hormone or androgen derivative. Basically, you take it, try and boost the male type hormones or testosterone-like activity in the system. And the idea is that some women do take DHEAs pre-IVF to try and improve their response in IVF, to try and get either more eggs or better quality eggs. So that's the theory. If you look at the evidence, unfortunately, there isn't any good direct evidence to say that it is beneficial. There's some very good level 1, so gold standard level 1 medical evidence to tell us that, so a meta-analysis, what that means is looking at all the studies on one particular topic and then squish it all into one meta-analysis to look at an overall conclusion. A meta-analysis looking at DHEA before IVF, unfortunately, did not increase live birth rate. So it is something that some specialists do use and some women do choose to go on, and that is to help improve the number or the quality of eggs that we get in IVF. But unfortunately, to date, there's still no very good level 1 conclusive evidence that is any benefit.
Oh, okay. Thank you for explaining that so beautifully, Alice. Okay, we've had a question. Okay, I'll jump to this one from Cordelia. What is the oldest age that you can successfully get pregnant naturally? And would you recommend freezing your eggs if you're single in your late 30s?
Oh my goodness. Oh, what a loaded question.
Yes.
So
Great question though.
so I have enough experience in the field that I'm doing to sort of be comfortable in saying I don't know. There is no answer. I think about the first part of the question is how old can you be? We don't actually have a test for fertility. That is the issue. So there's no test that I can do on a woman to tell me if she's fertile or not. Therefore, there is no test that I can do on a woman to tell me how long she will stay fertile for. The only true test of fertility is a baby. And so we actually have to try for pregnancy before we know if we're fertile or not. So, you know, the $1 million question is, how long do I have, doctor? Can I wait to have a baby? How long can I wait before I miss my chance? Unfortunately, ultimately, there is no answer to that. We do have tests for quantity of eggs. So it tells us the quantity of eggs that's still left in our ovaries. We do not have a test to tell us quality of eggs. The only true test is the baby. So there's no fertility test. So asking me how old, how the oldest that can fall pregnant naturally, I don't actually have an answer for you because nature is weird and wonderful. And we have to remember that I'm a fertility specialist. So people come to see me when they have difficulty falling pregnant. And so the ones that are the very lucky individuals out there in the community in their 40s that fall pregnant naturally very easily, and I know that they're out there, they don't come to see me. So unfortunately, I'm not aware of them as much as the women who come and see me who have difficulty falling pregnant. So the first part of the question I can't actually answer. Second part of the question is very, very personal. Okay, so freezing eggs basically is not really sort of as a guarantee of a baby, because we know that in nature, not all eggs will become a baby. And we know that in the laboratory, not all eggs will survive the freezing and thawing. And so the idea is that we won't know if the eggs that we freeze will become a baby until it comes time to use it, because the ultimate test is the baby. And so if we are freezing our eggs, the idea is that it's a second option. It's a third option. It's plan A, plan B, plan C for us. If you're freezing your eggs in late 30s, what that means is that if you decide to have a baby in your 40s and you have difficulty conceiving, you may have this backup option of using your eggs in your that were frozen in the late 30s. The issue is that we don't know if those eggs will become babies or not until they're used. So it's an option, but it's certainly not a guarantee. And the principle of egg freezing is that the more eggs that we freeze, the more chances that we get, and the younger the eggs are, the higher the chances. And so I think it's a very personal decision. If you're thinking about egg freezing, definitely deserve a conversation with your doctor. You should be exploring why we want to freeze your eggs. You'll be exploring, if we do freeze your eggs, what are your plans for fertility? So you can come up with a fertility life plan, basically.
Great. There's also another interesting question just on the topic of egg freezing that's come through from an anonymous attendee, asking if you were going to go down that path, would it make sense to wait, I think they meant 90 days, and optimize egg quality with things that you've spoken around about vitamins, sleep, diet before proceeding, or just go for it?
Yeah, look, 90 days basically is the consensus, so 3 months essentially. So what that means is that essentially eggs have to sort of undergo this maturation process before it's ready to mature and be released in a natural ovulation cycle or be picked up in an IVF cycle. So what's happening in the body now will affect the egg that's going to come out in 3 months' time. So if you, for example, if you're a smoker, right now, if you stop smoking this month and we pick up the eggs this month, it will still be affected by nicotine and things like that. We find that if you stop smoking this month, 3 months later, the eggs that's coming through have not been exposed to nicotine because you've stopped smoking 3 months prior. And so we have this magic number in our heads, 3 months, which makes sense because that's kind of the life cycle of the when the immature pre-antral follicles in the ovaries, the immature eggs sort of come through to become mature. So it makes sense. If we're trying to freeze eggs, we want to try and freeze the best possible eggs we can. So if we want to, if we find that our lifestyle is not optimum, definitely a good idea to live healthy for 3 months so that the eggs that you pick up will be, they will have absolutely the maximum chances for future use.
Oh, I'm learning so much here. We've had an interesting question come through in regards to sperm health from Tara. She or he asks, how does hot water like a swimming pool or sauna affect sperm health? It'd be great to talk about sperm health and heat in particular, because it comes up a bit.
Yeah, absolutely. So look, different individuals are different, but we do know that sperm does not like being in body temperature. It actually likes to be slightly lower in body temperature, and that's how nature designed them. So basically the sperm stays in the testes, in the scrotum, and it actually hangs away from the body. So it's actually not at body temperature. It's usually 1 or 2 degrees cooler. And sperm seem to like a cooler temperature. When it's the temperature is too high, it can actually affect the sperm production and can affect the sperm maturation process, so we can get more sperm abnormalities. So if we're trying to fall pregnant, and if there's so exposure to heat, so we're looking at people like chefs who are standing in front of a stove all day. We're looking at sort of elite, potentially elite cyclists, or even just men who cycle a lot. It doesn't have to be even elite, where they're sitting on the bike seat and the testes squished against their body, so there's heated to body temperature. All men who like saunas and spas and things like that. We do find that there tend to be a higher proportion. Not everybody's affected, but there can be a higher proportion of men in that population that have sperm dysfunction. And so the idea is that if we can take heat away, often that if it's a reversible change, that often reverts back to normal sperm production, normal sperm parameters. And I think just thinking of a case that I learned about when I was going through training about 12 years ago, out of a man that came through the hospital reproductive unit, and he was a welder that works in the garage and is usually covered in sort of petrol and oil. So what he does every day when he gets home is that he would have to take a long hot bath because that's the only way he can get all the grease off. And he came in because they had difficulty falling pregnant and sperm count was 0. So our specialist, the doctor that I was training with, asked him to stop taking those baths. He came back 3 months later and had normal sperm count, and they fell pregnant pretty fast naturally.
Wow.
And yes, it was a fantastic story. And then after that, after they fell pregnant, he went back to having baths, and then we asked him to do another sperm test 2 months later, and it went back to 0 again. So some men are just very, very, very sensitive to heat. So if you are trying for pregnancy, so I wouldn't say avoid heat, but if you're trying to fall pregnant and you have difficulty falling pregnant, and we do a fertility test and your sperm test is abnormal, and we know that in your lifestyle you are exposed to sort of heat more often than average, then we will recommend decreasing heat exposure. For modern day men, something to think about. Some men actually work with laptops. And they may instead of putting a laptop on the table, they may actually put it on the laps. And that can be an issue if it's they do that for 2 or 3 hours, because laptops can actually heat up and it's sitting right next to their the groin. So something to think about. I would only really advise someone to change their life if we can see they have difficulty falling pregnant, or if we can see an abnormal sperm test, then it would be worthwhile to try and decrease heat exposure.
And I have to ask, just on that topic, the age-old boxers or briefs debate. in regards to male sperm health and fertility. What are your thoughts? Is there merit in boxes over
Yeah.
briefs?
Look, I think whatever's comfortable for them, to be honest. It's only an issue if it's an issue. So,
Yeah.
whatever's comfortable, but if they're trying to fall pregnant, if you have difficulty falling pregnant and you have a sperm test and sperm test abnormal, then that is certainly something to think about, to change, to see if that will improve our situation. So whatever they're comfortable, but if there is a sperm issue, then it's worthwhile to consider boxes over briefs.
Right. I did see a marketing campaign recently for a brand of undies. I'm not sure if you've seen it, that actually have technology in the men's briefs to help keep that area cool. And they
Yes.
had laptops and sort of other things as sort of heat generating. And I thought either great marketing or it sounds like there might be something to it. So product
Maybe.
innovation out there.
There may be.
Yeah. Okay, so lots of questions coming through. Thank you so much, guys. And I will mention that if we don't get to your question tonight as well, we will definitely endeavour to answer it over the next couple of weeks with Alice, if we don't get to it in our drop-in community as well. Great question here has just come through from Nicole Greaves. What are some of the biggest myths that you've come across regarding fertility?
Oh, there's too many.
Too many. Pick a couple.
Oh, there are too
Top
many.
3 maybe.
Oh,
There are a lot, aren't there? There's a lot of old wives' tales, I guess.
Yeah, old wives' tales is a few. I
Yep.
guess in the very, very beginnings of my training, this is about 10 years or 8-10 years ago. I've heard a lot less about this now, but back for 8-10 years ago, I hear a lot about it. Must be some sort of chatter on a blog or chat group. But I was asked a lot about whether the order of orgasm when you're trying for pregnancy can determine the sex of the baby. So basically, if you're trying for a boy, then the woman should try and aim to have orgasm after the man, and vice versa. That's definitely a myth. That doesn't work. Other myths are different positions, I guess. Different positions during intercourse when you're trying for pregnancy is better for fertility or not. You have to stay lying down, legs up in the air, pillow
Legs
under
in the air.
pillow under the hips, and that's a myth as well. As long as the sperm is ejaculated in the vagina, you're trying. That you can't do much wrong when you're trying. Yeah, I think those are the two that sticks out in my mind.
Yeah, very interesting. I think that there's a method, well, there's a few methods out there, and there's quite a few discussions around gender as well. One that came through was whether or not the timing of conception could determine the gender. The timing of conception.
Yes, right before ovulation or right after ovulation.
So
early
it is
in
the timing.
Early in the. I've heard that one before. So early in the fertile window and later in the fertile window.
Yes.
No, that's a myth as well.
Oh, okay, right.
That's
right.
a myth as well. Yes.
Debunked. Okay.
Yes.
You spoke about diet a little bit as well, and it's awesome that you spoke about the Mediterranean diet. We've had quite a few speakers talk about the Mediterranean diet. We had Catherine Itsiopoulos, who has written a book on the Mediterranean diet, do an event as well, which is really interesting. Our community might want to check out. But specifically, Pikeri asked whether or not you had any ideas around specific foods to avoid or include that could help in the fertility journey.
Yes and no. So I know, disclaimer, I'm not a dietitian. It's really not, I'm far from being an expert. My perspective is it's always about balance. So, taking just one micronutrient at a time is not going to be very helpful. It's such a complex field in terms of, the nutrients that we take in, micronutrients, macronutrient. You need to take something to help absorb another thing. So taking something just by itself actually doesn't really work in my mind. And so to me, it's all about balance. It's about, having a good balanced diet, having, the rainbow vegetables, where you have not more than 3 or 4 different colors on the plate per meal, taking enough vegetables, taking, enough good fats like fish oil, things like avocado, a handful of nuts and things like that. And so from my perspective, I personally think that if we keep to a healthy, so not too high in animal fat, not too high in processed sugars and things like that, abstinence is not the key from my perspective. I think moderation is. So if we keep to a good balanced diet, what's good for your general health is generally good for your fertility health. So if you just eat a good balanced diet, healthy diet, I think that's the best thing you can do for your fertility. If you are concerned about the way that you eat, lifestyle, you can see a dietitian as well, where they can go through a food diary with you, looking at your lifestyle, and then see if there's a particular nutrient that you may benefit from supplementing. But generally, for most of us, it really is about getting that balance, that variety of good nutrients into your body.
Wonderful. We had a question around supplements, which you just touched on briefly then, in relation to taking folic acid. Obviously, you've spoken about the role of that in conception. How important are other pre-pregnancy vitamins in that picture, or is it really just the folic acid that's key?
Yeah. Look, folic acid is the one that we have the best level of evidence. So we're very, very sure that it is beneficial. Taking preconception folic acid 3 months before you try to fall pregnant, compared to someone who's not, actually decreases the chances of baby having that abnormality by 70%. So it's really, really beneficial. We don't have really a lot of information about other vitamins and things like that. And I think that's because everybody's different. You can't really just say, one tablet suits all. Some women's diet, or some people's diets are missing a certain micronutrients, and some are missing others. So I don't really think that there's a supplement that I can tell you that will benefit everybody. It really is looking at your own lifestyle and trying to supplement what is missing. What we do know is that even though we don't have good evidence about which supplement is better and essential in fertility, what we do know is again and again we have evidence that come through that you actually get a lot more micronutrient absorbed in the body through food and diet rather than through a tablet. Like a multivitamin tablet. So if you back to my first point, if you have a good, balanced, healthy diet, that is the best thing you can do, way above taking all the different vitamin supplements. If there's something missing in your diet, then that's when supplements really does help.
Good to hear, especially when, again, the marketing, is so good in the pregnancy and pre-health supplement space as well. So great to understand that, it's all within reach, through diet.
Absolutely. But look, reality is that most of those vitamins do not do any harm. And so if you're concerned, I've absolutely no issues with taking it, basically. My perspective, the marketing people may not like me very much. From my perspective, more expensive does not necessarily means better. They don't do much harm. Most of the vitamins are water soluble, which means that if you take excess, it just gets excreted in our urine. So you can't do too much harm with that.
That's reassuring to hear. Another question that came through from our community was, how much influence does my family history have over my ability to conceive?
Yes, there is an influence, absolutely. I'll probably say 50%. So essentially, you probably get the same predictive value as a flip of a coin, but it's probably more predictive than all the other factors, basically. So it's good to know, but I would not rely on that, because I do have women patients that come and say, "Oh, look, my mum had me when she was 38, so I should be okay to wait." We don't know that. That you probably just as much chance of being right or wrong as if you flip a coin. So from a family history wise, it's good to know, but I would not rely on it.
Okay. Might be a bit of a curly one, or might be a bit of a difficult one to answer, but we've had a few people ask, on average, how long does it generally take to fall pregnant naturally?
Good question. Well, there's some good population studies done sort of on just regardless of age, just the general population having unprotected intercourse after they get married or get together, and how long it takes for them to fall pregnant. What we do find is that 80% of the couples, when they're trying, 80% should fall pregnant within the first 4 to 6 months. And so if you don't have fertility issue and you're trying, majority should fall pregnant within the first 4 to 6 months. If you've been trying to fall pregnant for 12 months, your chances of falling pregnant in the following 12 months is about 15%. And if you've been trying for 2 years, the chances of falling pregnant in the following year is less than 5%. So the idea is that the longer we try, the lower our chances will become. And that's kind of a mathematical thing. So the idea is that if it's higher, you would have fallen pregnant earlier. So the longer we try, the lower our chances become. And this is why we generally say, if you're trying to fall pregnant, just go for it. If you don't fall pregnant within 6 months, it's a good time to talk to your doctor, your GP, or fertility specialist. Maybe think about further fertility testing in case there is something that's stopping you from falling pregnant. You don't necessarily have to start fertility treatment after trying for 6 months, because there's still a good chance that you may fall pregnant in the following 6 months. But it might be good to know that there isn't a particular infertility factor that's stopping you from falling pregnant, so we don't lose time if you need treatment.
Okay, excellent. Thank you so much. A few members of our community have said that they have endometriosis, and one of them has asked whether or not there's anything specific that they should consider in trying to conceive.
Endometriosis, yeah, it's a very common gynecological condition, and has very, very big implications about fertility and pain as well. But the fertility and with endometriosis, it's a very variable condition. So what that means is that some women with endometriosis will fall pregnant easily. Some women with endometriosis can't fall pregnant easily. Some women with endometriosis treated will fall pregnant after treatment, and some women with endometriosis after treatment won't fall pregnant. And so, I think that if, from my perspective, endometriosis is basically, it's generally a benign. It's not cancer, it's a benign condition, it's not life-threatening. It has two main implications as pain or fertility issues. So if you do have pain, you should actually get that treated sooner rather than later. If you have fertility issues and you don't fall pregnant within 6 months of trying, because remember that 80% of the time you should fall pregnant within the first 6 months if there's no fertility issue. So if you don't fall pregnant within 6 months of trying, then I think that's worthwhile considering treating that endometriosis, because that may be what's stopping you from falling pregnant. If you can't find, abnormal sperm or any other factors that may be stopping you from falling pregnant, I think that's worthwhile to treat at that stage.
Okay, thank you. Got lots of questions here. Probably got time for two more, just sort of looking at where we're at in time. The first one that I wanted to ask that has come up early on is whether or not miscarriage is a sign of infertility.
Miscarriage, that's a very interesting question. I'm trying to see how I can. Miscarriage is unfortunately a very common event in nature, and it can be caused by a whole host of different things. Majority of the time, probably about 80% of the time, the miscarriage is because the pregnancy itself is not normal. It's not meant to be a baby. And so nature realizes that and stops the pregnancy, and you either bleed or not, but the pregnancy stops growing. So that's a miscarriage. And so infertility is basically defined as difficulty falling pregnant. From our perspective, it's not just about falling pregnant, because when you try for pregnancy, you're not trying to aim for pregnancy. You're not trying to aim for pregnancy. You're actually aiming for a baby. And so we do consider women who have multiple miscarriages or recurrent miscarriages as having an infertility issue, because even though they are falling pregnant, they're still not having that ultimate goal, which is what they want, the baby. So yes, we do classify if you do have miscarriages, even though you are able to fall pregnant, so technically you are fertile, but you are not getting that baby that you want. So we do classify that as a form of infertility.
Okay, thank you. And the last question, and look, I don't know how much you can speak to that, but it's certainly a hot topic, COVID. Someone has asked, there's a couple of questions. So the first one is it a rumor that COVID vaccine decreases fertility? Is it safe for the baby? Can you speak to vaccination within pregnant women?
Absolutely.
And where people are currently at? Yeah.
Yeah, I'd love to speak to that. So going back to your very, very early question about myths and fertility, I would be happy to. I'll be happy to submit that as a myth. So no, COVID vaccine does not affect fertility. Okay. And so yes, there is a lot of concern in the general community about vaccinations, because the perception of the amount of evidence because the COVID vaccine was produced and basically given out worldwide in a very short, relatively short span of time. But it has been it has been used for nearly 2 years now, and we have very good evidence now that it doesn't look like it's associated with negative effects in pregnancy or when you're trying to fall pregnant. You know, you can never say never in nature. To me, you know, it's never, nothing's 0%, nothing's 100%, so nothing is risk-free. But you know, the Royal Australian New Zealand College of Obstetricians and Gynaecologists have actually come out with a consensus statement recommending that we offer COVID vaccine routinely to pregnant women, because they're actually now considered a priority group. From a trying for pregnancy perspective, my advice would be to get the vaccine if you're eligible, as soon as you're eligible. We don't recommend delaying one for the other. What that means is we don't recommend delaying vaccines because you're trying to fall pregnant, and we don't recommend delaying trying to fall pregnant because you've just had the vaccine. So we do recommend just absolutely get it if you're eligible. If you happen to be pregnant at your second dose, then if you had Pfizer, we say absolutely keep going with the second dose. If you had AstraZeneca, then we generally recommend not going ahead with the second dose. What that means is that you'll be partially protected, not fully protected, but then that's actually better than no protection at all. So if you look at the risk minimization and so weighing up the benefits and risks, absolutely recommend getting a COVID vaccine if you're eligible.
Oh, thank you. I think a lot of our community be really, really grateful to literally hear that directly from you, because it's obviously a hot topic bouncing around the community at the moment. That's pretty much all we have time for this evening. We've had so many wonderful questions come through, and I want to genuinely thank everyone who's taken the time to come along and ask their questions. And I'd love to thank you so much, Alice, for your time and wisdom and warmth. And yeah, it's been an absolute pleasure having you come along and speak to us tonight.
Thank you so much for having me.
Yeah, we'd love to have you back sometime as well, perhaps to answer some of those additional questions that we didn't get to tonight. So we've popped Dr. Huang's social handles in the chat box so you can follow along her work. And as promised, we've also put the link in the group chat box to check out Drop Bio and the Drop in Women's Health community to continue the conversation about optimizing health for fertility. Keep an eye out for our email over the next day or two to access the event replay. You might want to share that with a partner if you'd like to do that. You can forward it on, and that'll be within the Drop in Women's Health community as well. We are actually having a COVID Q&A, live Q&A session with a GP administering the vaccine next, the 31st of August. So we'll put the information of that out to the community over the next couple of days if you want to continue that particular conversation around the vaccine as well. But that's pretty much it for this evening. Thank you everyone for coming along. Thank you again, Alice. It was an absolute pleasure to have you, and we look forward to seeing you guys in the drop-in community soon.